60 Minutes Overtime.
This week on 60 Minutes, we take a look at the fentanyl crisis. This is the worst drug crisis the United States has ever faced, and it's taking some 70,000 American lives every single year.
I think he was just out having a good time and made a stupid mistake.
We met Mike O'Kelly and Angela King. They are the parents of Jack O'Kelly. Jack O'Kelly ingested fentanyl unwittingly and passed away. Mike and Angela found text messages between Jack and a drug dealer. He bought what he thought was Xanax, oxycodone, and a gram of cocaine, but the death certificate states fentanyl was the cause of death.
He wasn't seeking fentanyl.
He made a really bad decision, not one that should have taken his life, though.
The fentanyl flooding into the United States now is coming from Mexican drug cartels. The cartels make a pill that looks exactly like the opioid pill from a pharmaceutical company.
And it's almost hard to see.
Ann Milgram is the head of the DEA.
And here, what we have is a pill that is a real Oxy M30 and one that is a fake.
I can't see any difference. Look exactly alike.
Exactly, and that's the goal.
The same is for other street drugs. You don't know if the cocaine you're buying from someone has been laced with fentanyl. You just cannot tell if what you're purchasing has fentanyl in it. We went to San Diego. It is basically the port of entry for the flood of fentanyl coming across the border. They got hit with this fentanyl crisis earlier than most cities.
It has been difficult.
Dr. Stephen Campman is the medical examiner in San Diego.
For years, we saw 5 or 10 or maybe up to 20 deaths from fentanyl in a year. But then around 2016, the number of deaths started increasing above just 20, 30 and 80 and 150, made it up to 800 in just a few years. It had our system overwhelmed. So many people were dying with fentanyl, so we've increased staffing to handle the number of dead.
He says that about 1 in 5, 20% of the deaths he now investigates are deaths from fentanyl. What's an overdose look like? What does fentanyl do to the body?
As a central nervous system depressant, it causes people to sleep, lose consciousness, causes their respirations to slow, and then their heart rate to slow. We think the kind of typical fentanyl death is someone dies a sleepy, slow death, maybe is in a coma for a short time, maybe hours. But there are people that die with fentanyl that die a more rapid death. It's called wooden chest syndrome that causes a more rapid respiratory paralysis. People die quickly. Either way, people lose consciousness pretty quickly. Their bodies can look pretty healthy.
Dr. Campman has noticed a slight decrease in the numbers of deaths in San Diego, and he attributes that in part to the availability of Narcan, a nasal spray that contains the drug naloxone. The spray can counter the effects of an opioid. The problem he's seeing, though, is that instead of a spray or 2 of naloxone, sometimes they need 8 sprays. Sometimes they need more than people are carrying with them.
Even if someone were there and were able to get them 1 or 2 doses of Narcan, if they had a box, a lot of times people need 4 or 6 or 8 or 10 doses of naloxone to reverse their effects.
So even if you have the Narcan, someone has taken so much of the fentanyl that the Narcan might not be enough to revive them?
Correct. Just 1 or 2 doses might not be enough.
But perhaps most tragically, he told us that some of the bodies, the victim has the Narcan, the spray, in his or her hands at the time.
We see them dead with the medicine near their hand, the naloxone near their hand, or even in their hand, thinking that they would be able to save themselves. But they die too quickly. They lose consciousness too quickly.
Everybody we spoke to told us that drugs you get from any place other than a pharmacy with a doctor's prescription are untrustworthy. They're likely filled with fentanyl. And no one knows that more than Mike O'Kelly and Angela King. What's your message to other parents?
Get educated on the dangers of fentanyl. It's in every street drug right now, small amounts. Unless it's prescribed by a doctor, you can't take it. You're playing Russian roulette.